Australia is on a war footing, all according to the Prime Minister, who said as much to National Cabinet. Our adversary on this occasion, well, it's really the government declaring war on itself over the coronavirus vaccine rollout. Now, if the PM thinks that the political opportunists who comprise the committee known as National Cabinet are going to save us, then things must be pretty desperate. He said as much. There are serious challenges we need to overcome caused by patchy international vaccine supplies, changing medical advice, and a global environment of need caused by millions of COVID-19 cases and deaths. Now, there isn't much that we can do about vaccine supplies, quite frankly, except order some more. And we have to hope that they work as promised and that the weight of our money actually moves us up the queue from those who don't want to pay for them. The changing medical advice is another issue entirely. Here's just some of the stuff we've been told over the past 12 months by America's top infectious diseases expert, Dr. Fauci. We were told coronavirus was not a major threat, and then it became an apocalyptic pandemic, and then it was back to being a bad flu, then a global disaster again. And when questioned about the failure of his predictions, he said, well, you can't really rely on the models, even though the entire world based their response on those very same models. Fauci told us masks don't work, and then they did work, and then they don't work again. Lockdowns work, and then they don't. Double masking is actually the key. Well, the vaccine was meant to liberate us all, except Dr. Fauci says we still will have to wear masks and socially distance even after everyone's had it. Now, I could go on in these contradictory health warnings, but I'm going to cut the experts some slack. They haven't dealt with this particular pandemic before, so a little bit of guesswork is actually to be expected. However, blind faith in guesswork, even by experts, is not very wise. And if we are at war, then I'd suggest we're in a battle to the death with common sense, because it seems to have been vanquished when it comes to the coronavirus. And Australia's rush to vaccinate people with an experimental product, and make no mistake, this is an experimental product, seems unnecessary in an island nation with very few cases of this flu-like virus. Surely we can take our time, we can get it right, and in doing so we can also observe and benefit from what happens in other nations. You see, there is still a lot to learn about the short and long-term impact of these new vaccines on people. It's clear at this stage that they do help the vulnerable to stave off the very worst effects of coronavirus. However, the manufacturers don't say after vaccination that you won't catch corona or you can't pass it on. They also won't guarantee there are no side effects. And that's why the government is giving them an indemnity for any, and I quote, inevitable side effects. Now, as some of those inevitable side effects become apparent, the medical advice continues to change. It's like a war without end. Maybe we should call this the Afghanistan virus. Although that was likely to be deemed a little bit racist, we best stick with the Wuhan flu. Anyway, there is another apparent side effect revealed in the new study conducted by Tel Aviv University in conjunction with Israel's largest healthcare provider. And I need to point out that Israel has been praised, and quite rightly so, for its mass vaccination program, mostly using the Pfizer vaccine. It has led to a sharp drop in the recorded number of people falling ill. Yet this new study reveals a potential problem. It appears that those who have been treated with the Pfizer vaccine are 8 times more likely to be affected by the more dangerous South African strain of the coronavirus than those who have not been vaccinated. Now, it's the first of its kind real-world study, but there are a couple of caveats here. It was done on a very, very small sample, and it hasn't yet been peer-reviewed, for whatever that means these days. It also contradicts Pfizer's own research, which claims their vaccine is 100% effective against the South African strain. So who to believe? The researchers, the big pharma companies, or the government? Well, I say that's up to you to determine for yourself. But it does highlight that these vaccines are not necessarily the panacea some are predicting. And that's why I wonder, why are we rushing into another war? And this time, it appears it's one of our own making.